My name's Associate Professor Paul Lee-Archer, and I'm an anaesthetist at the Queensland Children's Hospital, and I've been a FANZCA for 14 years. Yeah, it can be tricky. A lot of people don't know what an anaesthetist or an anaesthesiologist does. I think in the simplest way I explain it is that we're the doctor that's going to be with you through your journey when you're coming for a surgical procedure in the hospital, and we're the ones that are there to keep you safe and keep you comfortable, and we're with you the whole time, and we have lots of fancy technology and things that we can do to achieve that, but in the end we're the ones that are going to be there when you go to sleep and making you feel nice and safe and comfortable throughout that entire journey. Well, I work with children predominantly, and so for kids it's interesting because a 2-year-old is very different to a 13-year-old, and so you have to adapt what you do to be on their level. So it's about getting down on their level for a child. Sometimes it might be singing a song if they're a baby or an infant. Telling a joke to some of the older kids works really well. But whatever it is, it's just making them feel comfortable. And then obviously then with kids, you've got the parents or the caregivers with them as well, and it's about making them feel reassured that we're going to be able to safely look after their child in this really important time. Look, I think there's lots of different people that go into anaesthesia, but at the end of the day, I think anaesthetists are all intelligent, they're caring doctors, and I think you want someone who's going to be cool and calm in a crisis. Because another thing that people may not know is that if there is a crisis within either the operating theatre or sometimes even around the hospital, it's often the anaesthetist who will take charge and sort out the problem. And that was certainly one of the reasons I got interested in the specialty. It was just looking at those doctors and thinking, yeah, that's really cool, and I'd like to be like that one day. I think anaesthesia has been one of the greatest advances in healthcare and medicine, and I'm still fascinated by the way that we can take a patient when they're most vulnerable, and we can make them feel safe, and they can be unconscious and pain-free for a surgical procedure, and then wake them up obviously at the other end. And obviously to do that, we have to be specialist doctors with a thorough knowledge of physiology and pharmacology. And I think what's really great about it is that it's been rapidly evolving over the last 170 years since anaesthesia was first invented, and I'm constantly amazed at the advances in knowledge that are coming all the time through our world-class researchers within the field, and that's what really excites me that in the future to see where we're going to be in another 170 years from now.